So welcome to the Finance Committee meeting of the City of Hudson for Monday, January 28th. First order of business is minutes of the past meeting. Any additions or changes?
Move for approval.
I'll second.
Any other discussion or any discussion? All in favor?
Aye.
Opposed? Motion carries. Next item is application for operator's license. If I can find those people, we have two. The approved issuance of regular operator's license for the period of 1/29/13 to 6/30/14 to Brian Scott Ekholm and Angela L. Rosenbush.
Move for approval.
Is there a second?
Second.
All in favor?
Aye.
Motion carries.
Did you do claims or did you just?
I skipped over claims.
Thank you.
And we'll do claims next. You have your claims, and you all received a copy of it in your packet and online. Any questions or comments?
No, I'll move for approval in the amount of $468,488.15.
I'll second. Any discussion? All in favor?
Aye.
Motion carries. Application of the Knights of Columbus, St. Croix County, St. Croix Council 1762 for a temporary Class B retailer's license to sell beer and wine for a fish fry event to be held February 22nd and March 8th, for a temporary Class B retailer license to sell beer on March 22nd from 4:30 to 7 p.m. at 1500 Vine Street, lower level of the St. Patrick's Church. I think this has been going on for many years now. Does anybody have any questions about this?
I'll move for approval.
I'll second. Any discussion? All in favor?
Aye.
Motion carries. Next item on the agenda is approved wage levels for EMT personnel. Kim?
And obviously this was a fun year for me doing the budget, so this was always entertaining and learning. But one of the things that Neil and I had discussed while we were doing the budget was possibly trying to increase the wages of our EMTs and medics just based on some things that we have changing. We're going towards critical care, which is requiring an additional 180 hours for our paramedics. And then we're also making some changes on the ambulance too. So we're requiring them to do more, we're asking them to do more, and there's no way for me to ask them to do more without giving them something more. And that wasn't the total decision. We're also trying to retain the employees that we have. We're getting to the point where we're almost going to start losing some because we can't keep up with a competitive wage for what we're asking them to do, because we are getting busier, taking more calls. So what I asked for, and when Neil and I worked on this originally for the budget, a lot of numbers got thrown around, and some of them kind of got, we kind of got lost in it a little bit. So I was asking for an additional wage for the paramedics so that way they could be compensated if they do take the critical care course, which is going to allow us to take transfers from Hudson Hospital to the cities, which is our revenue generator, and for taking that class and being available to take those transfers, because if they're not critical care trained, they can't take those transfers. And at first we thought it was going to limit us a lot, and then we thought it wasn't going to limit us at all. Now it's getting to the point where it's going to limit us a lot again as far as what our paramedics can take. We're already to the point right now where we have to give up some because we don't have the staff for it, but we have more coming through the program, and as soon as that's done, we can continue to take them. However, is it fair for a paramedic to get paid the same as a paramedic that doesn't take them when we're asking them to do more? So I'm asking that the paramedics that are critical care trained and be able to take those transfers get paid just it's under 50 cents. I think it's like 34 cents in one, 31 in another, for the paramedics. And then for our staff on the ambulance, again, for doing more, being available more, away from family more, I'm asking for an additional $5 per 12-hour shift. So not another $5 an hour, just per 12-hour shift for our basics, $10 for our intermediates per 12-hour shift, and $10 for the paramedics per 12-hour shift.
Go ahead.
The bottom line is it works out to be about $35,000 per year. And that was it wasn't incorporated into the budget at the time that the budget was approved, and so the discussion within EMS is it has to come out of the existing budget. There was talk about a new chase vehicle this year.
Which is in there.
Which is in our budget, but we really have to watch the revenue and make sure it's coming in at the rate we think it will. And we're going to have to make some adjustments, and Kim knows that, if this is approved and revenue doesn't show up like we're anticipating.
When we do a transport to Minneapolis or to St. Paul,
Yep.
how many of those, I don't have to know exactly, how many are
Medicare.
Medicare?
Medicare patients?
Yeah. Do you
What do
think?
we figure, Neil? It's usually about 50-50, I think, on all of our transfers.
Okay.
Right, I think
Somewhere around
that's
there.
fairly accurate.
Yep.
Because we charge out $800 to $1,000 how much is our call for a transport?
Depends on what it is.
Okay.
And that's the hard part, is there's different levels for each
Sure.
one. So it ranges anywhere between, I want to say $1,000 on the lowest level to $1,400 at the absolute highest. And the absolute highest are the non-resident ones
Okay.
that get charged out.
And so on the Medicare, what do we get paid? $240? Is that?
Do you remember,
Do
Neil?
you remember?
Generally, between Medicare and Medicaid, you're going to get somewhere between 20 and 25%.
Of the billing? Okay. So if it's $1,000, it's $250.
Yeah. But we're doing so many out of there that it's something that we don't want to give up, because we know it is revenue generating and we want to continue to take that. And it's built the relationship up with Hudson Hospital. They know they can call us. They know that we're available, and we want, especially with our, our citizens here, is we want to be able to take them where they
Sure.
need to go.
Now, Lori, in your EMS commission, did you have the conversation about what if the revenue's not there? What do you?
Yeah, and the one thing I brought up was the chase vehicle. And I think that's something we're just going to have to look at and potentially postpone. Because we didn't approve a budget that included this. So I probably put up the most fuss of anyone. And, if you look at it, it's pretty nominal per shift, per hour. We know we rank kind of in the middle of local services, relative to Baldwin and Richmond. But then if you look into the cities, which is where a lot of our folks come out of, we're a little bit on the low side. So I think this is going to just kind of help us hold our ground a little bit. Like Kim said, with the additional critical care certification that's being required, that's just so we can continue doing some of these transports. We are asking quite a bit of these
Yep.
folks, and so Devin.
The only question I have, the 45 cents and the 34 cents, is that in addition to the 1% they already received?
Yes.
Do you know?
Just the ones that have critical care. If they don't have the critical care certification,
Okay, so this
then
is-
they wouldn't get
okay,
it.
so
But yeah, it would be in addition to
1%
it.
was already implemented, this would be on top
Yep.
of that, just
Yep.
so I know if it gets
Yep.
approved, how to
Yep.
implement it. Okay.
Well, I'll make a motion to approve the increase. Is there a second?
I will second.
I think we should probably take a look in June and see where we're at as far as,
Agreed.
One, effective dates, just so we're clear, what I had mentioned before, would be with the end of February
Yep.
Payroll?
payroll for the monthly, and then the February 15th payroll for,
The ambulance.
which, because there's a payroll this week, for the
Yep.
for the biweekly paramedic people.
Yep.
Of course, if they don't have their certification, but just so that's clear, so that.
And
your
it's
people
not
know.
even in effect yet, because technically we don't have it under our license, the critical care, so it's not even in effect yet because none of us are
So you'll let me know
operating.
when?
Yep.
Okay, then that's fine, I just
So
wanted
we're
to make
actually
sure.
probably on hold until we figured the middle of March, beginning of April
Okay.
was when we'd be able to go live with it.
okay.
Thank you.
Any other, Randy, any questions?
No.
Lori, anything more? All in favor?
Aye.
Opposed? I guess if there's 3 ayes, there wouldn't be anybody opposed, would there? Item 6, approve Public Works 2013 service charge rates.
I don't know if Tom
Mr.
wants to-
Zulli, is he,
Thomas back there?
do we know
I
what
thought it
those
was
rates
under
are?
consent item, but
Huh?
I thought it was under consent.
It is for council.
Oh, okay. This is charges that we charge for Oh, when we do service work for, if there's an accident, if there's a streetlight knocked down, if someone requests to have parking lot swept or things like that, it's for the vehicles or equipment that we use for any of those activities. Neil suggested that we look into the Wisconsin DOT highway maintenance service rates, and they base theirs on, they're reviewed every year, and it's based off of depreciation and increases through just the cost of living. So we just felt that this was brought forward to the Public Works Committee, and they approved doing this, and it's just using the Wisconsin DOT rates for our service charges. It's an annual fee. It's reviewed annually. It's based on depreciation, and it'd be more consistent when if we were to submit a bill to the state for if mutual aid or for things like that. This would be the rate that we would get also. So we just feel it's more uniform, and we should utilize the Wisconsin DOT service rates.
So how much of an increase is it? Or is it an increase, or is it?
It's a little less than what we've been charging on a couple items.
Okay. And we can see that up in your office, or you've got it upstairs? We didn't get a copy of that in our packet.
I guess we can.
At least I didn't. Did anybody else get it?
It's a slight decrease, but we didn't have any basis every year. We just would review it and say, okay, we're going to increase it 3% or whatever the cost of living was. Okay. So this is more uniform, and I think we at least have a standard guideline to use for it.
I think the other thing is that this listing is far more comprehensive than the previous listing in terms of pieces of equipment. And I think if you look at it and say, what does it really cost us, at least there's a basis for it. But I mean, even where you charge for a truck, this charge may be less. However, this has an additional for, what type of plow you have on it, what kind of attachments, and you can also add on for those attachments. So it's really, and I think it's, as Tom said, it is updated annually. It is based upon the actual, cost of the piece of equipment, recovering both your cost and the annual maintenance. So I think it's, it's a good solid basis.
And when we're talking about how much this amounts to in a given year, it's not significant, is it?
No, it's for, like, say if there's an accident, a streetlight got knocked down, we would still use the current rates for labor, the city's current rates for labor. So, it's just a matter of a few incidents per year. So.
Okay. Your motion to approve?
I will make that motion.
Second.
Any other discussion? All in favor?
Aye.
Item 7, authorize city engineers to proceed with updates to the city plans and specification requirements. Tom or Karen?
Thought you said you were
I guess
going
it's
to
Karen, huh?
do this for $5,000.
No.
Oh, now you changed.
This is a work order to update the city's specifications and detail plates. They were last updated in February of 2010. And over the years, we see things that can be changed to make the detail plates and specifications better.
Do you want to tell people what the detail plates are?
The detail plates are a drawing that shows how to put in a typical section of the road, or how to put in a hydrant to meet the city standards, how to put in a storm sewer catch basin or a storm sewer manhole, gate valves.
Contractors then would bid on that, on
Yes.
these specifications then?
So what would happen is if you have a development coming into the city, the developer's engineers would get the detail plates, incorporate them into their plans to make sure that the contractor will put them in according to the city's standards.
Okay. Questions, comments?
Move for approval.
Is there a second?
Second.
All in favor?
Aye.
Opposed? Motion carries. Item 8, consider pay increase for police department casual call officers. Chief Jensen.
Thank you, Mr. Mayor. As you can see from our issue sheet, our casual call program has been in effect since 2004, and our casual call officers have been at the same pay rate of $12 per hour. I did a little checking with some of the municipalities around us that have part-time or casual call officers. As you can see, we are the lowest end of the four of them. Obviously, the top end being St. Croix County and Glenwood City obviously being at $12.50. Because our casual call officers do a lot of the same things that our full-time officers do, they're out on patrol by themselves, they do traffic enforcement, they do OWI enforcement on the weekends, they do medical transports for us when we need to on mental health facilities. I felt it was time to take a look at a pay increase just for them, obviously, to make sure that they're getting a good wage, but also to make sure that we're retaining these people, because obviously if these other jurisdictions are offering more money, we might be losing some trained individuals. So I do have the money within my budget of $20,000. What I would have to do is just make some scheduling changes. Early in the year, instead of having 2 casual call officers on a Friday and Saturday night, I would have just 1 up until we start getting busy again towards the end of March, first part of April. Then we'll have 2 casual call officers working on Friday and Saturday nights as well. So as I'm not asking for an increase in my budget at all, I'm just looking to make a pay adjustment for these officers.
Questions?
Instead of 2, you've got 1 on top of how many other regular officers we have on a Friday, Saturday night?
Usually on a Friday, Saturday night, I'll have 2 to 3 midnight officers along with a supervisor. So there's usually 3 to 4 full-time officers out, depending on vacations and training. And then we have the casual call officers on top of them. And majority of the time, what they're doing is they're up doing a lot of our traffic enforcement, especially during the night. And they'll handle our minor calls for service, alarm calls, or a barking dog complaint or something along those lines. So they free up the full-time officers to spend more time on, obviously, the more urgent calls for service.
Okay.
I'll move to approve. Is
I'll
there a
second.
second? Okay, any other discussion?
Effective date.
I think the effective date would be not this, obviously this pay period, but probably the next one coming up, which would
So
be
that would be January 26th would be the start of that pay period.
correct.
Okay.
All in favor?
Aye.
Aye. Opposed? Is there any other items that you would like to see on the finance agenda for next, I guess it's next week?
No, 2 weeks.
2 weeks. Okay, I'll make a motion to adjourn. Is there a second?
Second.
All in favor?
Aye.
Aye. We're adjourned. Thank you.